Hello, everyone, and welcome back to the Empower podcast. We have our guest, Kerry Tushoff, with us here. This is, if you don't know what the Empower podcast is, it's a podcast run by healthcare professionals and general healers of the community for healthcare professionals and general healers of the community with continuing goals such as raising transparency and awareness within the healthcare field and having a continuing goal of having legislation passed in the state of Colorado and in the United States mandating employers to provide employee wellness programs, which which will include about three things. First is the uploading of funds into an HSA account that is tax exempt at the federal, state, and local levels. And that's for all healthcare professionals per quarter. Also, a minimum of 8 wellness days per quarter, which can be from burnout down to a potential loss on the actual unit. It can be any of these kinds of incidents that can happen. And then third is the establishment of an anti-retaliation department in all healthcare systems run by a third party. At Empower, we believe in the power of community, diversity, and inclusivity to create positive change and help improve society. Our podcast aims to amplify voices that often go unheard, featuring interviews with individuals and organizations who are making a difference in their communities and beyond. Through thought provoking conversations and inspiring stories, we strive to raise awareness and promote action towards a more equitable and sustainable healthcare realm for all. All right, everybody, it's time to sit back, be yourself no matter what, and get ready to be empowered. All right, our guest, Kerry, thank you for being here. Where are you coming to us from?
From Southern California.
All right. We encourage our listeners to share whatever it is they'd like on the podcast about themselves. We are on all platforms now, almost Spotify, Apple Podcasts, Apple Podcasts, YouTube, and beyond. So this is a part of the show, Kerry, where we give a big community thank you to anybody that's maybe had an influence to you in any part of the healthcare team or just the general community.
Well, there are a couple of doctors. One in particular, Jeffrey Illick, who showed me a long time ago that there are doctors that are very open to learning new things. And I want to just say thank you because it made a big, big difference to me. Do you want me to explain what that was?
Yeah, nothing wrong here. Absolutely. Please feel free to share.
Okay. So, so I'm the founder and director of Hypnobabies, and we don't hypnotize babies, but we do teach pregnant women hypnosis and hypnoanesthesia so that they can have a much easier pregnancy, birthing, and postpartum by using hypnosis techniques. And when I created this program a long time ago, I knew Jeffrey Illick from having attended births where he was the obstetrician. And so when I started Hypnobabies, one of my students asked me to be her doula, which is a labor assistant, and she was a first-time mom. So she had every right to be, scared, not knowing what was going on. However, in Hypnobabies, since we teach them all of that and we teach them to stay calm no matter what, when she went into labor, they called me up in the morning and said, well, her water broke. And I said, oh, okay, what are you going to do? Well, we're just going to hang out and bake cookies and listen to our hypnosis tracks. And we'll call you later if we need you or when we need you. And so then they called at 5 o'clock and said they were going to the hospital. And I'm like, do you want me to come? And he said, nah, not yet. So 2 hours later, he calls me back and says, you know, she's at 9. And I said, okay, I'm not there. She must be doing really, really well. And he goes, yeah, she's using her hypnosis. So he asked her if she wanted me to come, and she goes, yeah, she can come. So I went, and when I walked in, she was sitting next to the door in a chair, just looking like she was sleeping in the middle of a contraction. And I look up and I see Jeff Illick sitting on the bed, on her bed, with his jaw hanging open. And he turned to the nurse when she was finished with her contraction, and she looked up at me and smiled. And he said, how far along did you say she was? And she said, yeah, she's 9 centimeters. She's almost fully dilated. And he looked at me and said, that hypno stuff must really work. You need to come and do an in-service for me in my office. And it meant the world to me that an obstetrician was willing to learn this new thing that could benefit people so much. And he is still that same wonderful guy. So that was a turning point for me, that where I knew that we were, we really had what we needed hypnosis wise for the moms, and that we could reach the obstetricians as well to help them understand how much more beneficial this could be than either gutting it out and having no drugs, or having drugs and having potential complications.
Hmm. Wow. I was going to say, for me, with the integrity of this and seeing that moment, I guess, that you captured with that, and to see it now, um, what does the integrity of healthcare look like when it comes to assisting in these kinds of ways, I guess, and being able to provide this if they are by insurance or by some kind of supplemental plan, or is it just out of pocket? Or, I guess for me, is it really supported in a system where there could be the introduction of dual modalities, while certain, simultaneous events are occurring, whether it is someone even prepping to be able to give birth, or someone prepping even for surgery. I could even see the application beyond, if it were allotted and supported in certain realms, in like the surgical realm. I don't know about that, because for me, I mean, I graduated in 2016, so to hear these other areas that are there, they're there, but they're like, and you have to look for them. You have to keep your ears open, and they're, I mean, I knew a lady, I'll never forget it. She is no longer with us now. She had a stroke and whatnot. Great connection when I met her. She healed someone's back wound with, but she said this all her verbatim, with honey in general. The surgeon didn't even know how. There's these different connections throughout our bodies that we can use and tap into, and that we are, I think, tapping into. And to see, and I think I did check out your website, and I think you've been around since like the 90s or before, right? A little bit before. Was it late 80s?
About the year 2001.
Okay. Oh, okay.
Yeah.
Okay, I got you. Thank you for the clarification. But still, regardless, I mean, and I guess for me, there was a big question I had, because I was thinking, what was a question I could probably ask her? And not that I couldn't ask yet, probably a million. But when it came into birthing too, have you looked into the potential research? And I've seen it off and on when it came to dolphin assisted birthing too.
Well, it's interesting. Many years ago, when I first started becoming a childbirth educator, I saw birth videos of women who would give birth in the ocean, like along the shoreline. And I did see a couple where the dolphins were there, and because of sonar, they could tell there was a baby in there, and they could tell this thing was happening, and they kind of acted like midwives. Of course, that's a very rare scenario, and 95% of all women in the US, and therefore our students at Hypnobabies, are giving birth in a hospital. Um, some, will some places have tubs, where you can get in and labor, but then they want you to get out, so that there's no potential problems for the baby. And actually, water birthing is quite amazing. I had my second baby in a big tub of water, and they come out into the exact same environment they're already in a big,
Right.
container of
Yeah.
water.
Yeah.
And so it eases their way into the world, actually, to be born into a tub of water, and they can actually stay under there for several minutes while the cord is still pulsating the blood from the placenta to the baby,
Hmm.
pulsating it out into the baby. They're getting oxygen.
Hmm.
We didn't do that with my son. He came right up. But yeah, I mean, dolphin assisted birth, that would be extremely rare.
There was one where they even tied it, and I'm going real fine tuned into here, but that they tied it even with IQ. And I didn't even know if you've even looked back, if you wanted to share with, if you, your own research, if you've gone back with these births that you have assisted with, and seen what that potential impact has really had on just the overall quality of life, I guess, is the biggest thing for me that I am looking at too. Is, but yeah. And to see sometimes that there's honestly nothing wrong here with administering this kind of a kind of yeah, any kind of modality or practice that maybe is not taught in schools. Because I'll never forget it. Back in nursing school, I had one day one day in my foundations of nursing where we went over alternative and complementative therapies. That's all they called it. Yeah, I know. I know.
Well, there are a lot of alternative therapies, as you know. Um,
Absolutely.
the way that I got, I'm not sure I'm answering your question, whatever it was that you asked,
Mhm.
but the way that I created Hypnobabies came from me actually having two very painful births. And during the second birth, where I was screaming my head off because all I had was relax and breathe, and that's not going to cut it with back labor.
Mm.
I realized that there had to be a different way, that if people wanted a more holistic, unmedicated experience out of childbirth, and many people do, um, there had to be another way. So then I decided to create it. And so I went and I used hypnotherapy, or hypnosis and hypnotherapy, for my own birth trauma, because it was both births were so traumatic to me. So I used hypnosis. Then I found hypnotherapy. Then I became a hypnotherapist. Then I started studying pain management with hypnosis. And that's how I found out there was something called hypnoanesthesia. That is something that, in rare cases, people are allergic to medical anesthetics and they still have to have that surgery. So they work with a hypnotherapist ahead of time. And basically, that part of the subconscious is retrained, and given new software to, really accept fully in those months, if we keep the hypnosis coming and those post hypnotic suggestions coming, that when they get into the surgery, the surgeon's knife is going to feel like a tingling sensation, or maybe some pulling sensations, instead of having your flesh cut open. So if people could do that, then we could use it for childbirth and many other things, if we only were going to use it the right way.
Mm-hmm.
So I put it into Hypnobabies, and the rest is history. There have been thousands and thousands of people who have used it and had much, much easier births. And not, some pain free, but not everybody's going to have a pain free birth. But it could also be used, if we used it the right way, to help kids, to help people prepare for surgery. And there are hypnosis tracks and techniques and things out there. If you go to a hypnotherapist, almost all of them know how to prepare for surgery and other procedures with hypnosis to make it more comfortable, and help you recover easier afterwards with hypnosis, because your mind actually controls your body. And people don't really believe that. But if we taught our kids that from the beginning, from when they were wee little,
Mm-hmm.
hey, your body control, or your mind controls your body. And so let's just get that all worked out now, and be thinking about positive things, and be thinking about, the best, and be thinking about, what you want instead of what you're afraid of. All of those things that can really, really help the mind body connection, because it's very, very real,
Mm-hmm.
to maybe prevent illness, and also, when if it comes on, to help us heal much easier. And there's a wonderful doctor in Boston called Bill Kamen, and he actually did a study on the language that his staff was using, that medical care providers use with patients, and came to the conclusion that if we changed our language, so instead of saying, now this is going to burn, you know, say, it might be intense for a minute, it might not, we'll see what happens. The difference was huge in the
Yeah.
patient's response, and therefore, of course, their fear level
Mm-hmm.
before the response.
Mm-hmm.
And that's very, very important, because the fear of the pain is just as important as the pain itself, and can make it much worse. That's what's called a nocebo, warning people that something is going to feel a certain way. And here you are, the authority figure
Mm-hmm.
in their life, caring for them, telling them it's going to burn or sting really badly, but it'll be over in a second.
Yeah.
No, tell them something more general.
Yeah.
It could be intense. That could mean anything.
Yeah.
And then they can manifest that if
The
they
power
do.
of language. Whoa. Wow. Okay.
Yeah.
Yeah. And the wow, okay. What was the other one? I've heard recent one too. What was the one I heard recently too? It was mentioned by my partner, not just in that area of society, but just in general. Like, my partner, she works at a daycare. She did mainly, and I guess they're even looking into verbiage for the youth. Certain words that we're not supposed to use for certain parts anymore because a teacher misinterpreted it incorrectly. Like, instead, the word was cookie, and it was someone licked the cookie, and the teacher was like, okay, whatever, for like a week or two, and then finally, what happened came out of it, and they found out what was actually happening just through language, though. Like, that's just the impact of language, even, and you were talking about on patient care, but societally, like, to see that overall the body keeping
Well,
count is the way I say it. Like, it's our neural networks too of seeing when these words come out.
exactly. And people don't realize that either. There's so much to know about language. And there's a wonderful little starter book called Words Can Change Your Brain. And it's the basis of this thought, which is that they have studied what happens in fMRI machines to our brains when we say or think or hear positive words, which is that neural connections are created and parts of the brain are actually benefited by these things. And the flip is the same as well. So even if you were to just say the word no, 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 and somebody heard it and you said it, both of your brains would be affected. Both of you and them, whenever there's negativity. So with children, it's really great if we start them out, telling them, for instance, what we would like them to do instead of something fearful, because the mind's language is imagery. So instead of saying to a child, don't run in the street, you'll be killed by a car, you know, we should say, stay on the sidewalk, it's safer here with mommy. The imagery of the first one is scary and horrible and not likely to get you what you want, because the mind actually jumps over the word don't and goes to the subject of the sentence, which is go in the street. And that's true for kids or adults. Um, so the second one actually creates imagery in the brain that safeness is with mommy on the sidewalk. And it's the same with anything else we do. If we say, don't forget your keys, the mind jumps over the word don't, and it's forget your keys, forget your keys, forget your keys, forget your keys. And that's what the subconscious mind hears.
Right.
So that's what it's going to try and produce.
Wow.
So instead, it's remember your keys, remember to pick up the kids at 2, instead of don't anything. And also, we have a free track at Hypnobabies called Affirmations for Kids that we just, whoever wants it can have it. And it's 16 minutes of helping your children say out loud these wonderful things about themselves. I'm so smart. I'm so capable. I remember everything I need to remember. I am patient with myself. Sometimes I make mistakes. And just, you know, every morning, if we taught every child to say positive affirmations about themselves, how would the world change by the time they got to be 10 years older? You know
Wow.
what I mean?
Yeah, power of language and just the overall influence of, what is it? Sound, frequency, and vibration too. I mean, and it's out on the internet. It depends on who wants to do the research and stuff, but there's the 2 jars of rice with the ones you say you love, you love, you love into, and then there's the ones that you literally just neglect and you say negative things to and you put it wherever else, and they've seen that the one stays with no, well, the love one is the one that has no real growth from it going onto it, no molds, no funguses. It's literally just fine. And then the one that had all the negativity, and it's literally at the micro level. Yeah.
It's the same with, you can do that with water.
Mm-hmm.
You can
You're
do
right.
it with plants. I mean, it's amazing what we emanate. And it's amazing what happens in our brain because of what we emanate. And when I say emanate, it starts with a thought, because the thoughts are what creates the changes in our brain. And also, then our brain tells our subconscious, and our subconscious creates more beliefs, and the beliefs create behavior. And so our decisions are made based on a thought. So we need to keep our thoughts positive and based on what we want and not what we don't want. And I always say to people, if your goal was to say, buy a VW bug, how much time would you spend researching and going to car dealerships and asking all your friends about buying a Tesla? You would spend absolutely no time, zero, zip, nada, because it wouldn't get you anywhere near your goal.
Hmm.
So, what you want to do is focus on your goal, and then your mind, your conscious mind tells your subconscious mind to then create more beliefs about that, which give you new ideas about how to get that. And you research in the right way, and then you make decisions based on that and not something that you don't want. So it's very important for all of us to think in that direction.
Mm.
You know, what do I want, and make it positive and use I statements. You know, I see myself with a VW Bug driving along with the top,
Yep.
blah blah blah.
Already
You
become
know,
it. Yeah, and see yourself. You're right. Yes, it's amazing too. And we don't think the body's keeping count or listening, but and they say even too before you go to bed, if you're really thinking about wanting something to happen, that's the time. It's one of the times when you tell your subconscious like, this is what we're gonna do. Like this is what I want to try to create. This is what I want to be able to generate. And it's like whether you think it's keeping count or not, it's keeping count. Like,
exactly. And what people don't realize is that that is a state of hypnosis right there. We are in states of hypnosis. You know, when I say hypnosis, it conjures up for people, stage hypnosis, quacking like a duck. Somebody did something to
correct. Or
you,
they
and now
saw
you have to
something
sing
that
like
wasn't
Elvis.
there, or yeah, yeah.
No, 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 no.
Nope.
So we are in states of hypnosis all the time, when we're going to sleep, when we're waking up, when we're reading anything, when we're watching a screen of any kind. And how many screens do we have in our lives?
Hmm.
We're in a state of hypnosis. And of course, driving. When you've been driving for a while and focusing on what's going to happen when you get there, and then all of a sudden you're like, what happened to the last 5 minutes? I kind of lost it. You were in hypnosis. So we're in hypnosis many, many times a day. And that's why when you tell yourself, right before you go to bed, I see this. I see that I have plenty of money. I see that I'm abundant in friendships and love and, positivity and all these things. It's because you're already in an alpha state. You're already in a light state of hypnosis. And then you go to sleep and your subconscious mind goes, yep, I got it. That's what they want.
Mm. Wow. And to be able to look into that and to know that you can have time for yourself to learn about what it is that's really going on too. Some people, they don't have time to learn that, how your brain really functions and what you can really do to operate your brain, and what can really come out of when it's used correctly, and to even, here's the big one, is to acknowledge what's really happening first. Yeah.
Yes.
Yeah, that's the one. And then, and before any of the other practice, I think, comes, is to acknowledge it, and then to just to be with it, because it is, it just is, and there's only from there, I guess, is the way I look at it. So, yeah.
Yeah. I mean, again, if we taught our children to even meditate every morning,
Mm.
these concepts would not be strange. You and I would not even have to have this conversation
Mm-mm.
about how the mind works, about neural connections,
Wow,
and
why
things
make it
like that. Our
complex?
kids
Yeah.
would have grown up in a different way so that they really understand the whole mind, body, spirit dynamic, because it's just one big picture, and it connects with everybody else's mind, body, spirit. And if we taught our kids that, things would be just so different.
Hmm. Oh, totally. And there's
Yeah,
this. Oh. And I want to acknowledge too. I pick a part in the show where I say, "Does this guest make you feel empowered, Brett?" And yes, Kerry, you definitely make me feel empowered. Thank you.
thank you.
Hmm.
I appreciate being able to come on and educate people about things that they didn't know
Yeah. Actually,
25
here,
minutes ago.
would you? Is there any kind of a empowering piece of advice that you'd maybe look to someone looking into going into the line of work within healthcare and community healing that you do?
Well, Hypnobabies, we have a lot of doulas who are labor assistants and midwives out there, and then former students who are so enamored with the way that Hypnobabies works that they become Hypnobabies instructors. And so once a year in the springtime, we hold a big training, and, contact me at director@hypnobabies.com if you are one of those people and you would like to join our team, and we can get you trained. We also have doulas that are traditionally trained by other organizations who would like to learn how to birth assist a hypno couple, someone who is using hypnosis, which is very, very different, in a more effective way. We have a hypno doula program. So I invite you to join us.
Got it. All right. Well, this is part of the show too. If we have a quote that you'd like to share that before our overall farewell here on this awesome podcast that we've had an episode with you, Kerry Tushkov.
um, well, from one of the first things I ever learned was a quote from somebody who said, "Babies are such a wonderful way to start people," and that's just something that I always say and something that I always think, because these precious little people come into the world and they deserve to have a really gentle birthing, one that is not, where their bodies are not full of drugs, and also not hearing their mothers scream for hours and hours. And so it's one of the reasons why I do what I do. So it's not my quote, but it is somebody else's quote that I really love.
Wow. I appreciate it. And the overall share of that, because it is, I mean, that's it. That's where I was there. I was that big. I had that happen to me, but wow. I've yet to ever, and I'm just so blown away because I haven't had someone of a guest on here, and it is something to just be recording too. But yeah, and I appreciate that, and just an outreach to everybody else. If you've been considering coming on as a guest, please check it out. Subscribe, check us out, and share us, because I'd love to continue to give back and raise transparency as to what is happening and what has been happening in healthcare. So thank you very much, Kerry.
You're welcome.
All right, thank you. Bye for now.